The gift of life. No object, no riches in the world, no dream anyone could live, no place you could go will ever be greater than this. It changes the way you live, the way you think. Sometimes for the better, sometimes for the worse. The Meyer family knows this all too well, for they have started the hardest battle of their lives.
My name is Donna Garrett. My sister's son, my nephew Mason, was diagnosed December 8th, 2011 with multigrade oligastrocytoma. Mason was born, let's say September 23rd, 2010, to Mark and Annette Meyer of Harper. They were expecting a girl. All the sonograms said girl. They had pink clothes, pink bedroom. Baby's name was written, Grandpa does woodwork, and the baby's name and the girl's name in woodwork. Everything was up in the room, and Annette started to have a serious complication, and they had to take her in for an emergency C-section, and the nurse came out and told Mark, he is here. And it's a boy, and so we all went, he? And Mark let me know that he was here, and that was my first question. He? Yes, it's a boy. Funny little baby. Mark's little clone, looks exactly like Mark, and full smiles, and Mama's little boy, and started to walk about August, and he fell down and cracked his head on the fireplace, and then he wouldn't walk anymore. And we thought, well, he's just scared to get up and walk again. Mason turned a year old, and he still wasn't walking. And when I had my son, Annette came up to the hospital, and Mason still wasn't walking and kind of seemed a little wobbly. They knew something wasn't right, but furthest from their mind was a brain tumor. So they set up an appointment for the pediatrician, and they said, well, let's go in and get an MRI. And they had the MRI, and she didn't even make it out of Wichita, and they called and said, you need to take him to St. Francis. He's got fluid on his brain, and we need to do some more tests. So she went straight to the hospital and checked him in, and they started looking further, and they found the tumor on his brain.
There are many different types of brain tumors. My understanding is this patient has an oligastrocytoma, which is a combination of two cells, an oligodendrocyte in the brain, which is a support cell in the brain, and a glial cell, which is another different type of support cell in the brain. So for this patient, he has a grade 2 malignancy, is my understanding. Grade 1 malignancies are pretty much normal brain tissue. The grade 3 malignancies are highly malignant, highly aggressive. The cells are dividing rapidly. And a grade 2 tumor then is in between. The treatment for children and adults with brain tumor is surgery. The neurosurgeon will evaluate the MRI scans prior to surgery, will plot out where the critical areas of the brain is before surgery so that he can avoid them, and then he'll go in and remove as much of the tumor as he can on the first take. Often the patients have a tumor the size of a walnut or an agate presentation. We're always amazed at how big they are. The brain tolerates that swelling until it reaches a point where there's some sort of critical progressive event that occurs. Any patient with a grade 2 brain tumor is not good. It'll be remarkably stressful on the family and on the patient. The cost will be $100,000 to $200,000 a year, and then additional costs for transportation to and from the medical center. There's costs for loss of income for employment that people aren't able to go to work. There's costs for out-of-pocket expenses of feeding the patient and the family and housing the family when they're not at home. Everyone does as much as they can to help the child with a brain tumor. It's a tremendous challenge, and often the patients will do well. The family initially gets tremendous support from the community, but this process is a 2 or 3 year process, and often families are embarrassed to ask how a child is doing. and they don't know how to interact with someone who has a child with cancer. Cancer is not contagious. The family needs tremendous help socially and emotionally with this difficult thing. So it's important to not forget about the child or the family 6 months, a year or so after this. It's a big fight. It's a long fight.
The reason we started this was originally to help Annette pay for some pictures that she wanted of Mason before he lost his hair from the chemo. Unfortunately, it didn't happen. They ended up having to leave right away for St. Jude, so we didn't get the pictures done. But I thought, they've got bills coming. I mean, yeah, insurance covered part of it while he was in Wichita, and St. Jude is going to cover the medical expenses and the lodging while they're in Memphis. But there are bills coming from the hospital on the co-pays and the deductibles that they're going to be responsible for. There's the hospital and the clinic and the surgeon and the doctor and the anesthesiologist, and they all send separate bills. And then Annette is a stay-at-home mom, she doesn't work. And Mark is taking a lot of time off to be with his son and to be with his wife to try to, make things a little bit easier. And that means the income is going to go down. And with that means those medical bills aren't going to be able to be paid. And they still have a house to take care of. They have to pay for their fuel back and forth from Memphis back to Kansas, back and forth. And that's just what this is all for, is to pay the medical bills. And if he's not making enough at work to get his fuel to get him back to Memphis and back and forth to work, then that'll help him pay for fuel. And hopefully the income that he has while he does work is enough to pay the bills. But if it's not, then there would be something set aside to give him a little hand to help them out. We hope that Mason's needs will be small and what we raise will be large, and whatever's left we will distribute to St. Jude or some other organization that can help us get the funds raised to a family that needs it. So we don't expect to stop with just Mason. There's tons of other kids out there that fight this, and Mason's cancer is extremely rare, but brain cancer and cancer in children unfortunately isn't rare. So whatever Mason doesn't need, we'll give it to somebody else that does. We'll just do a big thank you to Annette's family out in western Kansas, aunts, uncles, mom, stepdad, everybody out there in western Kansas, and Mark's family in Hayesville and El Dorado, up in these areas, helping out with the concert. They've done an amazing job of helping things, getting things around and donations and everything made to make this very minimal expense. So they've done a fabulous job. They've been very supportive. They've just lots of love shining down on Annette and Mark. It's been great.